Hello. With the United States population, with 80% of the United States population destined to have lower back pain in their lifetime, and it costing between $1 and $200 billion, two-thirds of that being lost income and productivity, you would think that every family in America would have their own chiropractor. Unfortunately, that's not the case. But everybody has their general practitioner, they have their dentists, they need to have a chiropractor. Hi, I'm Dr. Bruce Schneider of Schneider Chiropractic and Wellness in Garner, North Carolina. And, that's not to say that chiropractic's only significant benefit is limited to back pain. Nothing could be further from the truth. But these grim statistics are worth noting, and at least that's why I've been asked to do a brief talk about lower back pain. So to understand back pain, at least from a chiropractic perspective, you need to understand what a subluxation is. So basically, when the spine has been exposed to significant force or stress, and these bones of your spine, called vertebrae, shift out of place and put pressure on delicate nerves, and they lock up on those nerves, it can cause a lot of problems. You might have pain, you might have numbness or tingling or weakness or organ dysfunction. It just depends on what part of the spine is involved and what nerves are being involved. Now, the medical community normally attributes lower back pain to things like arthritis, disc problems, sacroiliac issues, muscle or ligament strains, abnormal skeletal structure like scoliosis, or infections and tumors. Now, in my 36 years in practice, I have found that the number one reason for lower back pain on the patients I've examined is spinal subluxation. And subluxations can cause spinal degeneration, can cause sacroiliac problems, can affect the disc and muscle and ligament problems. You get my point. So think of it this way. If you drive your car and the front end of it is out of alignment, the tires are going to wear out. And eventually your steering and the drivability of that vehicle is going to change. It's going to deteriorate. And eventually that tire could blow. And if it blows up, you can have an accident and definitely have some serious injury, definitely out of commission. So if your spine isn't moving properly and it's locked up due to subluxations, if the joints are under abnormal stress, they will wear. And the more they wear, the more pressure there is on the disc. And the more pressure there is on the disc, the more the disc will degenerate. And the more it degenerates, the closer the bones get together and put more pressure on the nerve. And the more pressure there is on the nerve, the more numbness, tingling, pain, abnormal function you will have. And the worse your health will become. And the worse your health becomes, the less quality of life you have. And the less quality of life you have, the more depression and anxiety you're going to experience. And the more depression and anxiety you experience, you just don't want to go there. Okay? You get the point. So if you just got your spine checked, your subluxations corrected, then you would most likely eliminate, or at the least, significantly reduce this downward spiral. I hope that makes sense, right? Of course it makes sense. So especially when you consider the other options, pain medication, steroid injections, they just dampen down the pain, but they don't correct the underlying problem. So, in fact, they can often delay the care you need and make the problem worse, because what happens is you don't feel the pain, you continue to do the things that are irritating or injuring those areas that are already compromised, and then you end up in the surgeon's office. And that's never a good idea. The success rates aren't great, especially when you consider how often or how frequently people who've already had spinal surgery end up having additional spinal surgery a few years down the road. So if we have bones that don't move properly and they put pressure on the discs and the nerves, is a drug going to correct this motion problem? Of course not. Chiropractic does. No drugs, no surgery, works with your body's natural ability to heal. Does that make sense? Sure it does. So that's all for now. I hope you found this helpful. Have a great day.